Hi everyone, I'm Dr. Miriam Smith. I'm excited that you have come to join me today on the Empowering You Nurses show. Wow, you have been following me and I'm excited. Today's episode we'll be talking about hand hygiene. It might seem simple, however, it's very, very, very important because we don't want to be transmitting disease from one patient to another. Organisms, not at all. We want to make sure that our patients are safe. Now, I want you to think of a shift and the number of times you must wash your hands. Just think about it. You must wash your hand before entering the room. You must wash your hand before you touch your patient because you could be transmitting diseases there. If there's a procedure that you'll have to do for your patient, you should wash your hands between that. Again, if you have to touch any equipment, you have to check a urinary bag or check an IV, after all of that, you could wash your hand. However, you could be using a sanitizer between. But remember that if that patient has C. diff, C. difficile, Clostridium difficile, that patient their hands should be washed with soap and water. Why? Because these pores aren't killed by the sanitizer, but it's killed by the soap and water. What happened? The soap and water, it lifts the organism from the skin. So that's very, very important. And how long do you wash your hands for? You wash your hands for at least 20 seconds. And by that, if you don't have a timer, you could actually sing the song Happy Birthday, starting from the beginning and to the end, ×2. Now, according to CDC, there are times the health care workers, not just the nurses, they might not wash their hand or less than maybe half the time that they should. I don't want you to be, I would like my new nurses to stick to the principles that are right. Okay, want you to get into the habit. Now, sometimes your hands might be a little dry, so you can have your moisturizing cream, your cream for your hands that you can apply at intervals. It's critical, it's important, and you know that nurses play a very important role. And you also have the responsibility to your co-worker and to your patient. If you see one that's not washing their hand, of course you're going to say it in a nice way, but you should let them know. You have that right too, because you're advocating for your patient and you're advocating for yourselves. And so we will say, we wash your hands before you enter the room. You wash your hand before you touch your patient. You wash your hand after you care for your patient. You wash your hand if you have to touch the surroundings there. And of course, before you leave that room, you wash your hands again. So these are some habits, tips. Just remember, if you don't do that, the patient, you can have a breakout because you did not. So let it not be on you. Let you make sure that you do your part. Thank you so much for listening. And these are little reminders. And as we go forward, we'll continue a little deeper. However, just bear in mind that the patient is depending on you, and it's your responsibility to give the highest care to every patient, high quality nursing care. Thank you. I'm Dr. Miriam Smith, and I'm your host for Empowering New Nurses show. You can subscribe, and you can follow me on Instagram. You can follow me on Podcast Smear and Facebook, Spotify, and Apple. So I look forward to hearing from you. Again, if you have a topic you want us to discuss, you can feel free to do so. I appreciate you coming, and I look forward to you subscribing and make a comment. And next week, weekly, you can look on to get another episode. Thanks again. It was a pleasure having you and hosting. Thank you. Miriam Smith, DNP.